And wow, we are at the end of a very long, intense, and inspiring journey that during the last 2 days brought us to meet a great variety of colleagues that joined the event from all over the world and sometimes from very remote settings. I'm very proud to be part of this very dynamic and vibrant pediatric community. We had incredible presentations, videos, panel discussions, and we also had a lot of interactions, question, comments from the participants. So thank you very much, all of you, for making this event very special. The Pediatric Days are not a scientific congress. They are a unique platform to share, listen, learn, inspire, and get inspired. A platform where professionals from different backgrounds and organizations gather to reflect together on possible solutions for key medical operational challenges, with a common goal to provide better care to our children, their families, and their communities. During this journey, we heard voices from a variety of different contexts, projects, and experiences. It doesn't matter who you are, who you work with, if you are a frontline worker, policymaker, an operational manager, an expert from academia. We all have stories to tell and to listen to. More than ever in this edition, we had a very diverse group of storytellers, most of which were frontline workers, and I think this is a great success. Each story is unique and different, but there are some very remarkable points in common, and I will try to wrap them up. I think the very first point is a fundamental one that has been transversal in each single presentation, and it's that the child has to be at the center of our medical action, along with his family and the supporting community. It has been said in our discussion, but I think it's not redundant to make it as the very first #1 take-home message. MSF is putting patient-centeredness and community engagement as a priority point of our strategic plan, but I think we need to keep talking about it until patient-centeredness and community engagement stop being a strategy and becomes just the way we work. The second take-home message, I would say, is that we face very complex medical issues and there aren't magic solutions. As a medical community, we face on a daily basis complex medical issues. Some are relatively new, such as antibiotic resistance. Some others are as old as medicine, such as TB, and yet we struggle to find easy solutions. There are also new challenges on topics that we thought were kind of simple and well standardized, such as, for example, the management of severe dehydration that probably needs to be redefined. We are all very much aware that there is no magic bullet. Complex medical issues require complex solutions, but we should keep in mind that complex doesn't necessarily mean complicated. We might not have the magic solutions, but we can aim for smart solutions. And during these 2 days, we heard a lot of examples. We heard about the importance of multidisciplinary work. We also heard about multi-channel change, multi-level approach, break the problem down in small components, are all very inspiring. So to tackle those complicated medical issues, we need to invest in operational research, digitalization, innovation, access to training, data sharing and analysis, advocacy. But while doing so, we should not forget the basic. And this leads me to the next point, point #3. Basic is beautiful. When we are in front of a very sick child or an extremely preterm baby, we sometimes feel very powerless. We wish we could do more. We strongly wish we had access to the fancy high-tech device or the powerful diagnostic tool or the very drug that we think could save the child and that it's not available in our service. This can be very frustrating, especially in contexts where resources and capacity are limited. But this should not make us forget that basic interventions used in a timely manner can massively contribute in saving lives, much more than we actually perceive, and even for the very severe conditions. During our journey, we listened to how activities like kangaroo mother care, breastfeeding, approaching health problems and malnutrition in the community, identify children exposed to TB and give them proper prophylaxis can lead to better chance of survival and thrive for these children. And this remains true and probably even more important in the time of COVID pandemic. These activities can be very effective and also very rewarding, and we should be very proud when we manage to successfully implement them, especially because despite their simplicity, we still struggle with their implementation. And aside very successful stories, we also heard voices about challenges and failures. And this leads to the next point, point number 4. We are all responsible for improving the quality of care we deliver, and the improvement can only happen if there is a safe space to fail in trying. We are all trying constantly to improve the quality of care we provide. And in the last 2 days, we heard many stories about challenges the teams are facing and the resources and the solution they found to overcome them. But I would particularly like to thank those storytellers that were brave enough to talk about failures, because it's from failures that we learn. This can only be done by creating a safe space for the teams to acknowledge their limitations without the fear of being blamed, reflect on root causes of problems, propose targeted solutions to finally come up with a plan for improvement, and eventually share their successful stories with others, maybe at the next Pediatric Days. And these bring us to the fifth and last point, and I think one of the most important one. When it comes to operational challenges, frontline workers must lead the reflection and the quality improvement process. Those that are close to the patients and the communities on a daily basis must have a voice when we talk about our programs and the operational challenges. They have to be given the means to take the ownership, be empowered to be the actors of change, and the space to speak out. And we really hope that the Pediatric Days are opening this opportunity for more and more people. That's why we ask you to choose the topic of this edition, and we will launch a call for ideas for thematic for the next one. So we are at the end of the 4th edition of the Pediatric Days, but the journey will continue. In the next few days, we will go back to our work with a wealth of new ideas that we can already share with our teams and maybe try to put into practice, because I like to think that each one of us can champion the change in his own working place. But the legacy of the Pediatric Days can also contribute to a larger reflection within the MSF movement and much beyond. The key messages and the operational recommendations that came out from this discussion will be summed up in the next few weeks and shared widely. For the International Pediatric Working Group, each edition of the Pediatric Days contributes to tailor our priorities on the needs of the field. And it also helped in the past and will help to have a better understanding of the limitation and potentialities of our medical action. But we strongly believe that the Pediatric Days can contribute to a broader reflection around humanitarian pediatrics. Humanitarian medicine in general has been redefined in recent years. Children are the ones that suffer the most, the direct and indirect consequences of humanitarian crises. And there is a need to redefine what humanitarian pediatric is and define a quite unique subset of elements that can answer the needs of the most vulnerable ones. This requires an understanding of humanitarian principle, context, conditions, but it also bears the responsibility, on one side, the responsibility to provide high quality of care, even under the most difficult conditions, but also to give a voice to the sufferance that we witness and experience in our work. So we hope that the Pediatric Days can promote exchanges among the different actors that are working in the field of humanitarian pediatrics to define together our agenda and priorities and strengthen our advocacy in the hope that our voices together can be heard more broadly. And I'd like to conclude by warmly thanking our amazing chair. Thanks a lot, Tish, for accompanying us during the journey, for helping us navigating the platform and fully enjoy all the different opportunities. Thank you for your kindness, your enthusiasm, and patience also. You really contributed to make this virtual edition of the Pediatric Days lively, inspiring, and really enjoyable. Thank you very much, and over to you for the closure of the event.